We know that science on its own can provide tremendous insights and improvements in the quality of life. We also know that the marriage of science to real enterprise can create the infrastructure that brings to society products of value. And in our field, we hope products of transformative value. You can't get more bleeding edge than actually this field of regenerative medicine where Harvard Science is internationally recognized as leaders. This program, both the Research Accelerator and the Entrepreneurship program at Harvard Business School, has been generously supported by Len Blavatnik and his family foundation. It's his willingness to support this vision of accelerating science and marrying it to commercialization that's really enabled us to reach across the river and create collaborations between our science laboratories and our business entrepreneurs.
It is no longer theory or conjecture that basic research contributes to saving lives and reducing human suffering. It is proven fact.
Stem cell transplants of the blood have been something that have been very transformative, brought people really back from the precipice of death. So if we can focus innovation in these areas, we think we can make a difference for transplant, and I think we all have a stake in this.
One of the questions that we've been asking is whether or not we can model aspects of these electrophysiological changes actually in the tissue culture dish with a patient's own motor neurons.
In my lab in particular, we're focused on understanding the biology behind tendons and ligaments to be able to harness that for regenerative medicine applications. What we're looking for are drugs that promote the formation of these tissues.
The challenge ultimately for us is going to be, can we actually do this in a way that mimics the actual biology? And I think we can do it. It's going to take a lot of effort. Ultimately, we might be able to look at that 55-year-old man and say, okay, you've got 40 years to go maybe in the modern world. So can we actually rebuild that heart tissue from the inside with a catheter so that you can have normal myocardium for the rest of your life?
And I believe that regenerative medicine will be the third great wave of medicine.
I'm going to invite my panelists up to sit down here. You can read their bios. As business people, we have the obligation, the responsibility to try to bring this science in an efficient way to the marketplace.
How do you get a provider to actually begin to agree that this is, one, a trial worth doing, two, it's actually one they're going to engage with, one, they're going to execute to the level that you need them to, the level of expertise. This is no longer, give a pill or hook up an IV. This in and of itself is a unique procedure potentially. So I think of the orthopedics example that was discussed earlier, and I think about what is the discussion like when you go to an orthopedic surgeon and you say, by the way, you've got one way that you do things and you treat patients. I've got this other one, and it involves a lot of things outside of you. Would you be interested?
There really is no patient population too small for a truly transformative treatment.
The entrepreneur should stick to developing the single best therapy for their patient. And if it's incredible and if it's awesome, then there will be wave on wave of innovation that will reduce the cost of delivering that therapy to the market.
How fast that happens will make an important difference to the future of humanity. The Blavatnik Accelerator is a powerful tool moving things forward.
So when we're talking about the formation of new groundbreaking companies, they're going to be happening here.
This is the right city, the right community in which we should do that. And we can do that. We have the right people and the know-how here to get it done.